Hi, Dr. Pelto here. Today I want to talk about a common foot injury seen in women in the United States. This condition is plantar fasciitis, but I want to discuss a specific variety that's caused by the tendon not working well. Here you can see an example of a foot that's collapsing at the ankle. The foot picture on the left has the ankle leaning inward. When this happens, there is more of a pulling and working of the tendon that holds up the arch of the foot. And this tendon is called the posterior tibial tendon. Its job is to hold up the arch of the foot, but in this case, it can't do its job. The tendon tries to pull on the arch, but it fails. And when this happens, there is more stress on the joints in the foot and the other soft tissue structures. A few problems can occur. The patient may develop arthritis of the foot joints. The patient may develop tendinitis of that tendon that holds up the arch, or there can be compensatory problems. These are other problems that can happen as a result of compensating in your body. One of the most common that I want to refer to is compensatory plantar fasciitis. Most plantar fasciitis is from tightness of the fascia and on the calf, but this one specifically is from the posterior tibial tendon not working as well. I recently saw a 36-year-old female that had severe plantar fasciitis for years. It was actually so severe, in fact, that she wasn't able to work, and even step caused her pain. It's not common for patients to have to stop work due to plantar fasciitis, but I want to show you that her problem was more than just the heel pain, but her whole foot felt like it was on fire. How did we treat it? Well, we first got x-rays that showed the middle of the foot, you can see in the picture here, is collapsing down, and there was some spurring on the top of the foot that is the beginning of arthritis. The patient has a heel spur on the bottom of the heel, but that isn't usually the problem. The reduced arch height, though, is a problem. Next, you can see the line on the right shows the talus bone that is uncovered from the bone in the front. This shows that the foot is flatter and putting more pressure on the tendon we talked about before, called the posterior tibial tendon. The x-rays are helpful, but a better way to look at the tissue structure is with an ultrasound, because we can see the tissue of the injury of the tissue. In this ultrasound, you can see the thickness of the plantar fascia. It's measuring 6.4 millimeters, and that's quite thick. And it's a black color that shows the inflammation. Now, how did we help this patient? Initially, we started with foam rolling and a night splint, anti-inflammatory medications, icing, and a contrast bath, and then also some physical therapy. I did an ultrasound on the first visit that displayed the thickening and the swelling. At the follow-up visit, I recommended custom orthotics, but the patient wasn't able to get them because of her insurance coverage. And due to the extensive amount of pain, she wasn't able to work and afford them. We needed to calm down the inflammation, and then we used a walking boot to start. Then afterwards, we did shockwave and bracing. So let me tell you a little about the shockwave therapy. We did 3 sessions of the shockwave with radial shockwave, and also the patient got casted for a brace called the Ritchie brace, which is an AFO, which means an ankle foot orthotic. And what this does is it helps prevent pronation. And the benefit of an AFO is that it's covered by insurance, where a common orthotic is not covered. So if you found this helpful, please like the video and subscribe to this channel.